go ahead and get started. In this video, we're going to be doing an introduction to inflammation. By the time this video ends, you'll have a firm understanding on why inflammation is important, the hallmark features, including the 5 cardinal signs of inflammation, acute versus chronic inflammation, common cell types and mediators involved in both, clinical relevance, and also we're going to do some USMLE practice questions to test your knowledge and also solidify it for the long term. Be sure to also check out our website, thehealingpowerofnature.com, and also our Patreon for the best materials on the market. I'd like to give you a little story to help you understand why inflammation is important. I want you to imagine a city with a well-organized emergency response system. If there's an accident or an outbreak or fire, first responders rush to contain the damage, eliminate the threat, or repair destruction. Inflammation is the biological equivalent of this system. It's the body's protective response to injury, infection, or harmful stimuli. Without it, wounds wouldn't heal, infections would spread unchecked, and the body would collapse under the weight of its own cellular debris. However, just as an overzealous emergency response team can unnecessarily destruct, think of water damage from overused fire hoses or reckless police actions, excessive or controlled inflammation can lead to chronic diseases like autoimmunity, tissue destruction, etc. Inflammation is a complex, coordinated response involving immune cells, blood vessels, and molecular mediators. Its primary functions can be divided into 3 distinct steps. First, to eliminate the initial cause of cellular injury, for example, infections, toxins, or even trauma. Second, to remove necrotic tissues or cells that are dead. And 3, to initiate tissue repair and regeneration. Inflammation is traditionally described by the 5 cardinal signs. It was actually originally outlined by the Roman physician Celsus in the 1st century AD, with the 5th added later by Virchow. So first, rubor or redness. This is due to increased blood flow or hyperemia. Cowler or heat, due to increased metabolic activity and blood flow. Tumor or swelling, due to vascular permeability and fluid leakage, also known as edema. Dolor or pain, due to release of prostaglandins and bradykinin, sensitizing nerve endings. And also functiolacia, loss of function, due to swelling and tissue damage impairing movement or function. Inflammation can be classified into acute and chronic, each with distinct characteristics and roles in health and disease. Inflammation is the body's defense mechanism, but not all inflammation is the same. Acute inflammation is the body's immediate response to injury or affection, while chronic inflammation is a prolonged response that can lead to tissue damage and fibrosis. So I've gone ahead and generated a chart for you to distinguish between acute versus chronic inflammation. I recommend taking a picture of this chart, keeping it close so you can review the differences between the two. Acute inflammation, its onset is rapid, often within minutes to hours. Its duration is short-term, few hours to days. The main cells involved in acute inflammation are neutrophils, your body's first responders. Its primary function is to eliminate pathogens and clear debris. The key mediators involved is going to be histamine, prostaglandins, leukotrienes, cytokines like tumor necrosis factor alpha, interleukin 1, and interleukin 6. The tissue outcomes are resolution, abscess formation, or progression to chronic inflammation. And some classic examples would be acute appendicitis, bacterial pneumonia, bee sting, etc. Contrasting chronic inflammation, the onset is slow, often weeks to years. The duration is long-term, weeks, months, or even an entire lifetime. The main cells are macrophages, lymphocytes, plasma cells. The primary function is persistent immune activation and tissue remodeling. The key mediators involved would be interferon gamma, tumor necrosis factor alpha, interleukin 12, interleukin 17. The main outcomes would be tissue destruction, fibrosis, and granuloma formation. Classic examples are TB or tuberculosis, rheumatoid arthritis, or atherosclerosis. This is an introductory video, so I'm going to go ahead and just talk about a little bit of these key mediators because these can be confusing. So let's start with acute inflammation. Histamine causes vasodilation and increased vascular permeability, leading to redness and swelling. Prostaglandins, one that you definitely need to be aware of is PGE2 or prostaglandin E2, causes pain and fever by sensitizing nerve endings and affecting the hypothalamus. So when you think of PGE2, a common mnemonic that's used is prostaglandin E2 because it produces fever. Leukotrienes increase vascular permeability and attract neutrophils. They also promote vascular contraction. Tumor necrosis factor alpha, interleukin-6, interleukin-1. These are pro-inflammatory cytokines. These are signals sent from cells that cause fever, leukocyte recruitment, and system inflammation. Whereas with chronic inflammation mediators, interferon gamma activates macrophages to kill pathogens and drive chronic inflammation. Tumor necrosis factor alpha, it promotes tissue destruction and persistent inflammation. Look at the name, tumor necrosis factor. So just from the name, we can learn it's tissue destruction. Interleukin-12 induces T cell differentiation into Th1 cells, leading to prolonged immune activation. And interleukin-17, which is involved in autoimmune diseases, promoting neutrophil recruitment and chronic inflammation. Think of acute inflammation as calling 911 during an emergency. Firefighters, like the neutrophils, arrive immediately, put out the fire, and leave. If the fire isn't fully extinguished or the damage remains unsolved, a slow, persistent process begins, which represents chronic inflammation. This is like a long-term rebuilding project with construction workers, macrophages, and lymphocytes, or additional recruitments needing to happen. Some high-yield examples for both: for acute inflammation, bacterial pneumonia, described as a rapid influx of neutrophils to alveoli leading to pus formation, or lobar pneumonia. Additionally, acute peritonitis, perforated appendix spilling bacteria into the peritoneal cavity. Or additionally, a sunburn. UV radiation damages skin, triggering inflammatory mediators like prostaglandins. Chronic inflammation. A common example will be tuberculosis, or TB. It's persistent Mycobacterium tuberculosis infection leading to granuloma formation. Crohn's disease. Chronic inflammation of the GI tract with lymphocyte and infiltrative and fibrosis. Atherosclerosis, chronic low-grade vascular inflammation due to lipid accumulation and immune activation. The cellular responders, who is involved in inflammation. I would recommend you take a picture of this chart as well. Let's go ahead and break down each of these. Neutrophils, these are your first responders. They kill microbes, produce reactive oxygen species, and cause pus formation. Pus is actually a way for your body to clear debris, and often, majority of which contains dead neutrophils. So if you hear the word pus formation, automatically think neutrophils. Macrophages, or your cleanup crew, they engulf dead cells, present antigens to T cells, and drive chronic inflammations, and it can also form granulomas. For an example, in TB, it is involved in your chronic immune response. So if you see macrophages, automatically think chronic inflammation. Lymphocytes, T and B cells, these are involved in your adaptive immune response. T cells activate immune responses, while B cells make antibodies for long-term immunity. This is your chronic inflammation. Mast cells, histamine release, vasodilation, allergic reactions, and anaphylaxis trigger acute inflammation. Eosinophils, your parasite killers, and also involved in chronic allergic inflammation like asthma, eosinophilic esophagitis, and its chronic inflammation. Platelets are clotting and wound healing, helps stop bleeding, release inflammatory mediators, and tissue repair. It is both chronic and acute. Inflammation underlies almost every major disease process, from infectious disease to autoimmune disorders and even cancer. Some clinical examples where inflammation plays a role: sepsis, a systemic, life-threatening form of acute inflammation. Additionally, autoimmune disorders like lupus or rheumatoid arthritis, chronic inflammation due to immune system dysfunction. Cancer, inflammation is a risk factor for certain malignancies, such as chronic hepatitis or gastric cancer caused by H. pylori infection. Neurodegenerative diseases like Alzheimer's disease is linked to persistent microglial inflammation. So some final thoughts: inflammation is a double-edged sword, okay? So inflammation is essential for survival, but if uncontrolled, it becomes a major driver of disease. Mastering this topic is crucial for understanding pathology, pharmacology, and immunology in medicine. Some key takeaways is inflammation is the body's protective response to injury and infection. Acute inflammation is rapid, neutrophil dominated, short-lived. Chronic inflammation is persistent, macrophagy and lymphocyte driven, tissue destruction. Clinically relevant in infections, autoimmune disease, and cancer. Throughout our videos, we'll continue to dive into each of these. This is just a brief introduction to inflammation. Let's go ahead and jump into a few practice questions. So question number 1, like I always tell you, read the last sentence, then read your options, then read the entire question. So I'll go ahead and give you a few minutes, and then we'll go ahead and discuss the answer. So the correct answer was D, macrophages. So remember, chronic inflammation is primarily mediated by monocytes/macrophages and lymphocytes, unlike acute inflammation, which is dominated by neutrophils. Let's go ahead and jump into the next question. I'll go ahead and give you a few minutes, and we'll go ahead and review the answer. So the correct answer was B, prostaglandins. So remember, prostaglandins, particularly prostaglandin E2, which produces fever, are key mediators of pain and inflammation. They sensitize nerve endings to produce pain by increasing the response of nociceptor to other stimuli such as bradykinin. Let's go ahead and do the next question. So I'll give you a few minutes and then we'll come back and review together. So the correct answer was C, granulomatous inflammation with macrophagy and T cells. So the description suggests TB or tuberculosis, which is characterized by granulomatomus inflammation, a subtype of chronic inflammation. Granulomas are formed when macrophages are activated by T helper cells or Th1 cells and surround the infection to contain it. Caseous necrosis is a hallmark of TB granulomas. If you found this video helpful, please be sure to check out thehealingpowerofnature.com and also our Patreon for the best study materials on the market. Thank you very much, and I'll see you next time.